Good evening. I want to thank everyone for joining me today. My name is Fred Adams. I'm the Vice President and one of the founding members of HSA for America. And I'm here today to explain a few different ways that you may be able to opt out of Obamacare, at least for the course of the next year. And over the course of my presentation tonight, I'll share with everybody 5 ways that you can avoid or at least postpone having to deal with the Affordable Health Care Act through some or all of next year. Now, before I get going, I do have just a couple of things that I want to say. First, I currently have all the phone lines muted, so we don't get any background noise or interference. At the end of the presentation, I will be available to take as many questions as we have. If you have a question that comes to mind as I'm speaking, you can feel free to go ahead and leave your question in the chat box for anybody that's logged in and watching the presentation online. And I'll make sure that I address those questions first. Once I've taken care of any questions in the chat, then I'll unmute the phone and take any questions that anybody wants to actually ask live. And the other thing I want to say before I start going through tonight's topic of ways to avoid Obamacare is over the course of the last 2 months, as I've been speaking with hundreds of our clients from all across the country, I have come to see firsthand that there's some people out there that are actually benefiting from this new law, and then there's others that are very, very upset and finding that the law that was intended to help the majority of people is actually hurting their particular situation. And normally when I do a webinar like this, I try to present the pros and cons of both sides. But tonight, given the sheer fact that the topic that everybody came to hear about is 5 ways that we can avoid the Affordable Health Care Act, at least for the next year or so, I won't be mentioning too many of the positive aspects of reform. So I'm not here today to bash the law or to say anything detrimental to what our government is trying to achieve, but I do want to share with everybody several different strategies or approaches that you may want to consider to make sure that the transition to how health insurance is going to be working in this country in the future is as minimally painful as possible for you and your family, whether it's for the next year or for years beyond. So with all that said, let's go ahead and get started. And as I said, I won't really be touching on reform or the exchange very much, but I feel like I would be remiss if I did not at least begin today's presentation addressing some of the issues that everyone in this country has been experiencing since the healthcare reform open enrollment period started October 1. And if you're somebody that lives in one of the 36 states that is using healthcare.gov to try to enroll people for new health insurance, you've probably seen at least one, if not both, of these images that are on my screen right now. Because the majority of people that have tried to go to that website and log in either haven't been able to create an account, they haven't been able to get their identity properly verified, or they run into a number of other obstacles. There have been about 100,000 people during the first 5 or 6 weeks of open enrollment that were able to successfully apply for health insurance through either the federal site or various state exchanges. But if you look at the number of people that typically apply for health insurance during the course of any given month, 100,000 enrollees is a tiny fraction of the number of people that are typically applying for coverage most other months of the year. So suffice it to say, whether you're in a state that's using the federal exchange or if you're in one of the states that's actually running their own exchange, most of the time these websites are just not functioning properly. And to make matters even worse, one of the fixes that Healthcare.gov tried to implement after a couple of weeks of people not being able to get quotes is they put a link on their website where you could go and get an estimate of what premiums might be for you and your family. And if anybody's tried to use that tool, you probably noticed you really just had two options. You could either enter that your age was 49 or younger, or you were age 50 and above. And the estimated premium that you were shown after that was based on, if you entered you were under the age of 50, was based on the cost for a 25-year-old. And if you entered you were over the age of 50, it was based on the age of a 50-year-old. So if you were older than either one of those two age brackets, the estimate that you see isn't remotely close to what the premium would actually be for you. So again, I'm not here tonight to talk a lot about the exchange, but if you're somebody that's gone there and you've tried to use that tool to estimate what cost may be for you next year, please be well aware that those estimates are far from accurate. Another problem that we've seen, especially with the federal website, is there's no guarantee that any of your information placed on that site is secure at all. In fact, you can all but be guaranteed that information that's going in onto that site is not secure. And I'm no computer security expert, so I can't explain the actual ins and outs of that. But I've talked to people that are and have looked at how that website is built and the various coding that's gone into creating the exchange. And everybody that I've talked to has indicated it is a hacker's dream and one of the worst put together programs that they've ever seen. And the final thing that I hope to say about the exchange this evening is, despite all the publicity or advertising or political rhetoric that you may have heard about the fact that there were going to be navigators available to help people figure out the exchange and which health policy might actually work for them, those navigators or customer service reps that are working in the call centers, whether you're calling the federal website or any one of the state-based websites, they are not licensed insurance agents. They cannot legally discuss with you how health insurance may work for you, and they certainly can't make any recommendation on which plan may be best suited for your personal situation. And to make matters worse, not only are these navigators not licensed by any Department of Insurance, they don't even have to go through background checks. There's actually former felons. There's videotapes out there of navigators encouraging people to lie to get lower rates on their health insurance. It is not the way that business was intended to be transacted, whether you were looking to the exchange for help or not. So all that said, that's going to be the last negative words that I hope to utter out of my mouth this evening about anything that's going on, because I'm here tonight to share with people that don't want anything to do with Obamacare 5 different ways that you can avoid working within that system, at least throughout the course of 2014. And the first option that you could consider, that you should consider, is to renew or keep your current health insurance policy. There are actually many insurance companies out there that are allowing their customers to reset the anniversary date of their policy to a day late in December. And the reason that that's so important is, according to the law, any policy that was not in place before 2014 and was not effective prior to the law being passed, which was on March 23rd, 2010, so any health insurance policy sold from the day the law was passed until the last day of this year, by law, must terminate at the anniversary date next year. So a lot of insurance companies are allowing you to reset your anniversary date, make it December 31st, keep your current plan, which for most people is much more affordable than anything available next year, and avoid the reform-related rate increases for all of next year. And I personally found it pretty interesting just about a week ago when our president was on TV suggesting that he was going to allow insurance companies to do what I'm talking about right now, and that's renew people's policies, current policies, and keep them through all of next year. And there's two reasons I found that so interesting. First, the law already permitted that before our president's speech last week. But even more interesting, just 2 weeks before that speech was given, paying a lot of attention to various press and media reports about what was happening with health insurance enrollments, there were a lot of publications out there that were bashing insurance companies, saying, how dare these insurance companies renew somebody's policy in December and help them avoid the Affordable Health Care Act for all of next year. And as a matter of fact, the commissioner of the New York Department of Insurance sent out a memo about a week before our president's announcement, both to insurance agents and to insurance companies doing business in his state, that said, if you are caught renewing your customers' policies before the end of this year for the simple fact of avoiding being compliant with reform next year, you may lose your insurance license or your ability to do business in this state. So less than a week later, our president had the great idea of let's actually let people keep their plan that they like through all of next year. Seems like I had maybe heard him say that quite a few years ago, but sometimes not everything you hear coming from a politician turns out to be true. So for those of you that do have current coverage in place and you are happy with it, in most states you will have the ability to renew your policy and keep it through the end of next year. Unfortunately, after that time, your policy will terminate and you'll be forced to look at other alternatives. And I do have to add the disclaimer there that only applies in most states, because there are a few states in this country where the insurance commissioner has told insurance companies, you cannot do that in my state. You must terminate policies at the end of this year. Even since the president's announcement last week, the commissioner of the state of Washington has come out and said he's not permitting that for residents of his particular state. So your options that I'm going to be talking about tonight could possibly vary depending on what state you live in. And as I wrap things up, I'll let you know how you can reach out to somebody that's a member of HSA for America that can give you specific advice based on the state that you live in. So a second way that you can consider trying to avoid reform for all of next year is by purchasing a new 2013 policy now. And again, your options are going to vary depending on what state you live in, and it'll even vary depending on which insurance company you select, because some companies are going to terminate your policy that you purchased today as of the effective date next year. Other companies may allow you to reset your anniversary date or your effective date to December 31st, so you literally can keep your new policy through all of 2014. But regardless of when a new policy you purchase today winds up terminating next year, unless you're somebody that has an income that is going to allow you to receive a very generous subsidy from the federal government to pay for some or all of your health insurance premium next year, by going ahead, taking action today, securing a policy with a 2013 effective date, you're going to save hundreds, if not thousands of dollars over the course of next year. And I should note that policies being sold today, they are not forced to be compliant with all elements of the Affordable Health Care Act. However, a policy that you buy that you are allowed to keep through whatever date the plan terminates next year, it does allow you to maintain health insurance coverage, so you are able to protect yourself from any catastrophic loss, which is what health insurance or really insurance of any kind has always been meant to do. And you also won't have to pay any tax penalty for not having a reform-compliant plan next year if you have a 2013 plan that you keep through the duration of 2014. And that brings me to my third possible alternative of how you can avoid complying with Obamacare next year. And you could just choose to pay the tax penalty. And I've been pretty surprised over the last couple months with all the people that I've spoken to of how many of our clients have indicated that they are very seriously considering going without health insurance next year and paying the tax penalty because they refuse to be forced into something that they don't want or believe in. Now, unfortunately, for most of those people, they've been under the misinterpretation that all their penalty was going to be next year is $95. And as we see here on my screen now, the penalty next year for anybody that doesn't have health insurance for at least 3 months of the year, it's $95 per adult in your household. It could cap out at 3 times that, or $285, or 1% of your family's total household income. And if you think about that for a minute, that means if your income is $9,500, you would pay the $95 tax penalty that everybody thinks is all they'll pay for not having coverage next year. But if your income's higher than that, your penalty is going to be 1% of your hard-earned income next year. And since anybody that's earning $9,500 or less, according to our federal government, should be on Medicaid, there's very, very, very few people in this country that will wind up paying a $95 penalty next year. As a matter of fact, just about every single person that could possibly be penalized, they're going to be paying 1% of their income. And the story gets worse the next year because that particular penalty jumps from $95 to $325 or to 2% of your household income. And then the following year and years beyond, the penalty grows to $695 per adult or 2.5% of your hard-earned household income. And I should also add, if you have anybody in your house that's under the age of 18, they'll pay a penalty for not having coverage too. Now, fortunately, that penalty is only half as much as an adult would pay. And there is a limit that the most penalty that anybody would pay is 3 times the individual penalty, which would have most families thinking the biggest their penalty could be next year is $285. But keep in mind, it's that $285 or 1% of your total household income, whichever happens to be greater. And for most people, that's going to mean they're paying 1% of their income, not $95 a person. But choosing to go without coverage and pay the tax penalty is definitely an option. And again, it's one that I've been surprised how many of our clients happen to be considering. Now, all that said, there are some exemptions that can allow you to not have health insurance or not have a compliant plan next year and not have to pay the tax penalty. And I won't go through them all in great detail, but just to hit on a few of the big ones real quickly. If you're uninsured for less than 3 months next year, you don't have to pay the tax penalty. So that means you could sign up for coverage after 2014 has already begun, and as long as your coverage is effective by April 1, you wouldn't have to pay this penalty we were just talking about. If you don't have to file a tax return because your income is too low, if a member of your household happens to be federally recognized as an American Indian tribe, or you're eligible through services through some sort of Indian service provider, if you're a member of a healthcare sharing ministry, that's something like a Christian co-op. One organization I've heard a lot about this year is called Samaritan. I can answer a whole bunch of questions about the problems with that particular type of coverage if anybody has any, but having that sort of plan does allow you to avoid any penalty next year. Or if you're a member of a religious organization who has a religious objection to insurance including the Social Security or Medicare program. And if you're incarcerated, you can get away without having health insurance and not pay a tax penalty, or if you're not lawfully present in the U.S. Now, in addition to those exemptions, there are also several different things that could allow somebody to go to their state marketplace or to the federal exchange and request a hardship exemption. And these are things such as if you are homeless, if you've been evicted from your home in the past 6 months, if your utilities were cut off, if you've been the victim of domestic violence, if you've had the death of a close family member, if you've experienced a fire, flood, or other natural disaster, filed bankruptcy, if you've had medical expenses in the last 2 years you couldn't pay, and a few other items. So I guess the main summary of this particular slide is if you want to avoid Obamacare for next year and not even have to pay the tax penalty, well, if you've been bankrupt or had medical bills you couldn't pay or you're part of a natural disaster, those are a couple ways you can avoid Obamacare through 2014. Probably not the best way to avoid this system. Now, for those of you that may be considering paying the tax penalty and just going without health insurance altogether, I would suggest to you that you consider possibly looking at a short-term health insurance policy. And a short-term policy, depending on the state you live in, some states you can only keep it for 6 months, though you could reapply at the end of 6 months if you wanted to. Other states you're allowed to keep a short-term policy for as long as 12 months. Now, this is temporary health insurance, but if you think back to one of the points I was mentioning a few minutes ago about any policy you buy right now must by law terminate by the end of next year. So even a policy that's being sold on the premise that it is a permanent health plan and the rates are set as if it is permanent health insurance, they're really all temporary health plans right now, unless you're signing up for something with an effective date of 2014. Now, if you're buying a true short-term policy, they typically have much lower premiums. The insurance companies are allowed to ask health questions and potentially turn you down, but with most short-term applications, there's 4 to 6 health questions. If you can say no to all of them, you're going to get approved. If you say yes to any of them, you're going to get turned down. So what if you're now thinking, well, maybe I'll consider a short-term policy for the next 6 months and kind of see what happens and let the dust from Obamacare settle a little bit. What would happen at the end of 6 months? Well, that would be after March 31st, when the current open enrollment period has closed. And after March 31st, unless you have some kind of qualifying, life-changing event, you're not allowed to sign up for health insurance again until next fall for coverage that would start the following year. But if you have a short-term policy, the simple fact that your current coverage is terminating, that is a qualifying event that would allow you a special enrollment period. So if you wanted or needed to apply for a 2014 health insurance plan after March 31st, you potentially would be able to do so. Now, if you had a short-term policy and 6 months from now you had not had any health issues and you could still say no to the health questions on that application, you could turn around and re-enroll in the same policy and have short-term coverage through all of next year. Now, since the coverage you have would not be reform compliant, you would still pay the tax penalty that we were just speaking about a minute ago. However, you wouldn't be in as nearly as potentially of a dire situation as another individual out there that just said, forget Obamacare, I'm going to pay the tax penalty and go without health insurance. I'm not going to agree or disagree with anybody's decision to make that particular choice, but if that's a choice you're considering, you are putting yourself and your family in the situation where if any major unexpected health issue were to arise, you could potentially lose everything that you've worked so hard in your life for. Because if you have a catastrophic medical event and no health insurance and no special enrollment period, or it's not during open enrollment period, you're not going to be able to get a new health insurance policy until next fall, and even then it won't start until January 2015. So if you're interested in lower premiums and avoiding the Obamacare system, and you're willing to pay the 1% tax penalty, but you don't want to go without some type of catastrophic protection, please consider a short-term plan. In a lot of cases, it can cut your premium by half or more. And I do have a real-life example here on the screen of what a short-term premium looks like compared to a 2013 or a 2014 plan. And this is not a made-up example. This is actually one of my clients that I spoke with today. He's a 28-year-old that lives in Aurora, Colorado. And the options that we discussed, he wanted to know about plans available through his state marketplace. He didn't want to pay what it was going to cost. And one of the most affordable plans that I could find for this individual was from Humana, a bronze level policy, had a deductible of $6,350, and it was going to cost this fine young man $187.79 a month. He had already told me that was out of his budget, but he wanted to see what it would cost. So he pretty quickly dismissed that. Then he wanted to look at a plan starting now that he could keep through all of next year. And the best option that I had that fit within his budgetary constraints was a policy through Anthem Blue Cross called Clear Protection. It had a $5,000 deductible, so a lower deductible than that 2014 plan that was going to cost more. And this Anthem plan with a 2013 effective date was only going to cost $120. And as I described to this gentleman how that coverage would work, I could tell he wasn't happy with the value he was going to get for his $120. So I said, well, would you consider a different alternative that I bet you've never heard of, or even if you have, you probably haven't considered? And he said, sure, Fred, tell me what you're thinking. Well, I told him about a short-term policy with a company called HII. It had a deductible of $2,500. So the deductible was half as much as the Anthem plan he was considering. And guess what? The premium was about half as much, too. It was only $62.99, a little less than 50% of the cost he would have paid for a 2013 plan, and 3 times less expensive than it would have cost him to buy a policy starting in January through the Colorado marketplace. So I know I don't have the phone lines open where anybody can answer me right now, but I'll leave it to everybody to just ask themselves, which of those 3 policies do you think this 28-year-old in Aurora, Colorado signed up for today? And I'll tell you this, the answer is it's not any of the ones that cost triple digits. It was the one that cost less than $100. And needless to say, he's very happy about having coverage in place next year and the fact that it's going to fit his budget. And I will also add, he understands that if he doesn't purchase a reform-compliant plan that's effective by the 1st of April, even if he has a short-term policy, he's still going to be looking at paying that tax penalty. So short-term coverage does not allow you to avoid the tax penalty. It allows you to get a much more affordable catastrophic protection policy than you're going to get purchasing a permanent plan now or purchasing coverage through the exchange. And I should also add that that's just one example. Sometimes the savings is even more dramatic. Sometimes the savings with a short-term plan isn't that dramatic. It really varies depending on your age and the price of health insurance, whether it's short-term or permanent, in the zip code that you live in. Premiums vary dramatically, sometimes even within the same state. So that was just one example. I selected it because it was somebody that I talked to today. and it illustrated my point perfectly. Now, a fifth consideration that you might also want to think about, and please keep in mind, this option number 5 would also leave you facing the tax penalty next year, but would make sure that you're not going completely uncovered. And this option is consider a variety of optional benefits, or something that I often refer to as ancillary products, that can give you some protection for things that might occur in your life that you don't expect, as opposed to just going through life with no type of insurance coverage for your health whatsoever. And I won't go into great detail in any of these today, but some of the products that you might want to consider to give yourself some protection at a very reasonable price. One is something that's known as an accident policy. The accident policy that I have, if I'm ever find myself in an unexpected event that results in an injury, which that's how an accident is defined, I would have a $100 deductible, and my accident plan pays the next $10,000 in medical bills. Now, I'm not suggesting anybody carry just an accident plan. I carry that with a high deductible health plan. So if I ever have an accident, that policy will cover all but $100 of my health insurance deductible, and then my health insurance policy will pay for the rest of the bills from there. And I know statistics as they relate to the healthcare field well enough to know that 54% of trips to the hospital are the result of an accident, not an illness. So odds are pretty good if you, me, or anybody else on this phone line tonight winds up in the hospital next year, it's more likely to be because of an accident than an illness. So whether you're somebody that's considering going without coverage altogether, or somebody that's maybe looking at a higher deductible policy, adding an accident policy is a great way to protect yourself from any of those unexpected events that may result in an injury. A similar type of product, which I also carry along with my high deductible health plan, is known as a critical illness policy. And different insurance companies define critical illnesses differently. Some critical illness plans only cover 3 things. Others cover as many as 20 different illnesses that are defined differently depending on which policy you buy. But a critical illness is something like cancer, heart attack, or stroke. And if you have a critical illness policy and you're diagnosed with any dreaded disease that particular policy deems a critical illness, your insurance company will instantly send you a check for the amount of your coverage. So think of this as a life insurance policy that will help pay your bills while you're still alive, instead of paying your loved ones after you've passed away. With a critical illness policy, I actually carry 2 on myself. I have one that is $10,000 worth of coverage, so that would help pay the deductible on my health plan if I ever have cancer, heart attack, or stroke. I have another one that's $60,000 in coverage, and it obviously costs a little bit more, but I like having the peace of mind of knowing if I am ever diagnosed with one of those dreaded diseases, not only does my wife not have to worry about where she's going to come up with money to pay my deductible, but she's going to get a second check for $60,000, so she doesn't have to worry about draining our savings to pay the mortgage or how she's going to go about paying for the rest of our bills while I'm potentially not able to work. So a critical illness is not a replacement for a health insurance policy, but it's a great, very affordable way to give yourself coverage that you might not have otherwise, whether you wind up with a health insurance policy or not. Now, something that's a little more common, I know most people go to the dentist once or twice a year. A lot of us have an annual eye exam, and those things can get fairly expensive. Well, we can help show you a way for $7 a month or less that you can get a dental and vision plan to lower your dental and vision cost by more than 50%. If you ever get your teeth cleaned once a year, that policy more than pays for itself. This next particular service is one I love. It's a fairly new concept, that I think as more and more people try to start using their new health insurance next year, and they start finding out that their doctor's not a part of the HMO that they bought on the exchange without realizing what they were getting and how few doctors were going to accept their new health insurance next year, we're going to see more and more people that want to start utilizing telemedicine services. The one that I personally use, which our company represents, is called AmeriDoc. With AmeriDoc, you can pay as little as $9.95, whether you're an individual or a family of 50 people. I don't know what family would have 50 people and be in the same household, but the price is the same whether you're an individual or a family. And the way the particular product works, you'd have an online account that had all your personal information. Anytime you wanted to talk to a doctor, you just log in and hit request. And you can request 2 different types of doctor visits. One's informational, so you can talk to a doctor and ask any questions you want, and that would cost you nothing. If you need to talk to a doctor to diagnose some sort of common sickness, maybe you have a sinus problem or allergies, or you're sick and need an antibiotic, well, you can request a diagnostic consultation. Within less than 3 hours, a doctor's going to call you. They will talk to you over the phone, or if need be, if they need to actually see you, you can connect via video conference, so they can maybe look down your throat to get an idea for what may be wrong. They will then call a prescription into the pharmacy of your choice, and by the time you get yourself in the car and get to the pharmacy, your medication's there waiting on you. And the cost of any of those diagnostic consultations is only $30, less than most of you probably pay to see a doctor today. And if you upgrade your AmeriDoc service, you can actually get those diagnostic consultations completely free of charge too, all for less than $25 a month. So I'm not going to go into that in any more detail unless we get some questions, but if you have not yet looked into some form of telemedicine service, it's great, especially if you have kids. Maybe your kids get sick in the middle of the night. You can't see a doctor till the next day. Well, AmeriDoc has doctors on call 24/7. And while the service says a doctor's going to call you back within 3 hours, the couple of times me or my family members have used it, it's never taken an hour. Less than an hour after we requested an appointment, we were at our pharmacy picking up our medication. We spent $30 to talk to the doctor, less than we would have going to our normal doctor's office. Better than that, we didn't waste an hour or 2 of our life sitting in a doctor's office waiting to be seen. And even better than that, we weren't in a room full of people that were maybe sicker than us, because I've left a doctor's office before sicker than I was when I got there, because I was around a lot of other people that were there to be diagnosed and treated, and illnesses tend to get passed along from person to person. So if you can cut the cost of seeing a doctor, cut the time that it takes you to see a doctor, and stay away from other sick people so you don't get sicker, that sounds like a pretty darn good deal to me, something I would encourage everybody to look into, whether you want to avoid Obamacare or not. And my last little bullet point here on my screen is, if you are going to be paying for your medical services yourself, please don't pay the full retail price. We can show you how to get discounts on prescription drugs. I'll tell you that secret right now. Go to a website called goodrx.com. That's goodrx.com. Enter the drug you need, enter the zip code that you want to pick it up in, hit submit, and you're going to see 10 to 20 local pharmacies. You'll see the retail price for that drug. You'll see the discounted price for that medication. You'll see a button next to it that you can use to print out a coupon, and you'll cut your drug cost by more than 50%. I take some maintenance medications every day, and I always order my prescriptions from there ever since I found this site about a year or so ago. And believe it or not, it cut the cost of my medication compared to showing the pharmacy my insurance card and getting my insurance company's discounted rate. And same thing goes for lab fees. Prescription drugs and lab work are the 2 items in the medical field that have a bigger markup than anything else in this country. And I hate hearing about people that pay the full cost to get any kind of lab work done because they are unnecessarily wasting their hard-earned money. And the way that we go about helping our clients lower the cost for all of their lab work is by directing them to a site called directlabs.com. If you go to Direct Labs, you can request any test that you want. You order it right there online at a discount between 50 to 90% off the retail rate. You're emailed a requisition form, which you can then take to the closest lab in your area. They do the lab work just as if your doctor had ordered the test. And in most cases, in less than 24 hours, you have the results in your inbox of your email. The first time I ever used this service, my doctor thought I might have high cholesterol, ordered a comprehensive wellness panel to be done, which is just a fancy name for taking some blood that tested 20-something different things. She wanted to charge me $550. And I said, thanks, but no thanks. I know how to order my own lab test. You'll have the results within 48 hours. Well, the doctor looked at me like I was crazy. When I explained to her what I was going to do, go home and order this test myself and go get the test done the next morning and then have the results in my inbox the next day and forward them to her, she actually sat there and told me what a great idea it was and that she would start referring her other patients there too. I highly doubt that physician, not to doubt her word or her honesty, but I really doubt that she's told any of her other patients how to avoid paying her $550 for something they could go home and order themselves for $97 or less. But that's what HSA for America teaches its clients to do, because we're here to help you keep as much of your money in your pocket as possible and not waste it by paying too much for health insurance, paying too much in taxes because you don't have the right kind of health insurance, or paying more for your medical needs than you need to pay. So several different tips there, and I doubt very seriously that any one of those checkpoints I just went over were remotely close to any suggestion anyone thought I would be offering this evening. But I believe in those 5 particular money-saving vehicles enough that I utilize each and every one of them. And if you knew me very well, you would know that I want to get the most from my dollar and stretch it as far as possible, because there's a whole lot of things in life that I can do and enjoy a lot more than overpaying a doctor or overpaying an insurance company. And I've gone out and found the ways to make that possible for me, and I love sharing what I've done to help other people as well. Now, the other part of this particular slide I'm not going to go into very much, but I did mention earlier, if you're enrolling for coverage on one of the exchanges or marketplaces, there's a lot of reports out there that data going through these websites is not secure, that it's a hacker's dream, and there's people just either waiting to scoop up data that you try to enter on healthcare.gov, or there's people out there that are trying to scam you into thinking that they're a licensed insurance agent, or maybe even to thinking that they're an untrained, unlicensed navigator, so they can steal your personal confidential information. Well, since we knew that this was going to be a big concern before open enrollment even started, we went out and found a company that offered identity theft protection. The company we work with is called Identity Guard, and they'll actually give any of our clients a 1-month free trial. If you want to keep the service from there, it's $16.99 a month. And if anybody ever does try to steal your identity, they're going to help you resolve the problem and give you $1 million worth of insurance protection for any possible loss that you may incur. So it's something that I would encourage everybody to at least check out. If you actually look in the chat box of the little Start Meeting control panel that's on your screen, my assistant has left a link there that you can use to sign up for the 30-day free trial. Whether you just want to check it out or keep it and protect your identity for years to come, it's one more thing that I do recommend. I signed up for the free trial because I was considering this product to fill a need for our company in talking to people that were worried about identity theft. And when I started getting an email, anytime there was a change in my credit report, if somebody ran a credit report or I applied for a new loan, Well, Identity Guard sends me an email pretty much instantly when that's reported to any credit bureau. I thought, wow, this is a great thing. This is a way I can very easily monitor any changes going on with my credit report. So if something's happening that's out of line, or somebody did somehow wind up with one of my credit cards and was trying to use it, I'm going to be notified in virtual real time, and then I have this company there to help me clean up the mess and pay for it, as long as it doesn't cost more than $1 million. So, quickly to recap before I start taking questions. I promised everybody 5 different possible ways you could avoid Obamacare, at least through all of next year. The first, the easiest, the simplest, if you do have a policy now and you're in a state that's allowing your insurance company to reset your anniversary date, keep your policy through all of next year, you probably want to do that. However, even if you do have that as an option, you might also want to consider the second alternative, and that's shop around for a new policy that starts this year that you can keep through all of next year. Because you may just find you're able to get a policy with a lower premium than you're paying today. And since you know that your current coverage or a new plan that you get, they're both going to end next year, well, if you can save some money over the course of the next year by changing plans one more time, sure seems to make a lot of sense, at least as long as you can pass underwriting and don't have any health issues that have developed since you purchased your prior policy. If you do have health issues and you may not be able to get approved, then you certainly just want to sit tight with what you have for as long as you possibly can. And if neither of those alternatives sound great and you are not going to be forced into complying with this new law, of course, you can pay the tax penalty. If you're going to do that, I would encourage you to at least consider some sort of additional coverage for yourself. Please don't go into next year without any catastrophic protection just to prove a point that you're not going to be forced to comply with the law. It may work out for you. It may not. We don't have a crystal ball, and we don't know what's going to happen to us next year. So going without any kind of protection to prove a point or to not be forced to comply might not be the best decision. And a short-term policy is one way you can get a lower premium, still pay that tax penalty, and wind up saving money in the long run. And if a short term doesn't work, or if maybe you're keeping your current plan or getting a new plan and it has a real high deductible, certainly consider some of those ancillary products that I discussed, whether it's an accident, a critical illness, a dental and vision plan, the AmeriDoc service. Even if you don't want to use any of those, please at least visit hsaforamerica.com. Go down to the bottom and look for the little button that says Additional Benefits, and that'll take you to the information where you can find out about discounts on prescription drugs, find out how to pay the lowest possible cost for any lab work that you may need, whether you have health insurance or not. And, of course, as I just mentioned, if you're worried about entering any information online, somebody may be stealing your identity, you can, of course, try the Identity Theft Protection Service at absolutely no cost. Cancel it within 30 days and you'll never pay a penny. And if you apply for that particular type of coverage online, as soon as you hit submit, your trial starts, you're covered immediately. So even if you wind up leaving this webinar and decide, well, none of these ideas were good enough for me to avoid Obamacare, I'm going to go to healthcare.gov, or I'm going to talk to an insurance agent at HSA for America or the person you've been working with previously. If you're going to be entering that valuable personal information online, you might want to make sure that you have some protection in place first to protect your identity, especially if it's not going to cost you a thing. So that has brought me to the end. Now it's time for questions. Let me look here in the chat box real quick. Does not appear as though we've had any questions come through online, so I'm just about to unmute the phone. If you do have a question for me, I just ask 3 things from you. Please let me know your first name so I know who I'm talking to. If you'd be so kind, let us know where you're calling from, and then let me know what question you have. So just 1 second, and I'll be ready. Okay. Nice. Even though I haven't heard a question yet, I'll just point out if they unmuted the phone line, that background noise, the reason the phone lines were muted during the entire presentation. I learned that part. Looking at my panel, I have quite a few still on the line. Nobody with any questions that have gone unanswered. I'll be real brave and put that another way. If anybody has any questions, and you maybe just vent about this law for a little bit and share your opinion, either on any of my suggestions today or what you feel about Obamacare and the Healthcare Act. I'd love to have a conversation with you about it.
My name is Kathy.
Hi, Kathy.
And I had a question about when I call an agent. I have an agent with this company. Do they have to go on healthcare.gov to shop for us a new policy?
No, ma'am, we do not. We actually are still using the same quoting tools that we've used in the past. Kind of have a back door into quoting system that's connected to different insurance companies. And when we do that, not only are we able to give you quotes instantly without you having to create an account on a marketplace and verify your identity and jump through a bunch of hoops before they'll even show you a price, we can look at prices to get a plan starting this year at a lower rate, look at plans starting January, and we can also help you calculate any subsidy or tax credits that you may be eligible for, lower what you pay for your insurance costs. And we can do all that without ever touching any of the state or federal marketplace type exchanges, whatever you want to call them. Well, yeah. Yes, we know how to get the quotes without. Thank goodness, because if we did not have that ability, I can't imagine frustrating the last one. I don't know.
Okay. My second question, if I'm able, I spoke to my husband's insurance agent that he was asking some questions, and he made the comment that he had submitted some applications for insurance, I guess on healthcare.gov, and they got lost somehow, and no one knew where they were. So I don't know how that would happen, but my question still ties to, if I do business through my agent, I am not connected to any of the government or state websites. That's correct, right?
I have to give you a two-part answer there.
Okay.
That's going to depend on whether or not you're purchasing coverage. If you're purchasing a 2015 plan, you definitely don't go through any state or federal website. If you're purchasing a 2014 plan that is considered to be for sale off of the exchange, there's insurance companies out there selling 2014 plans that don't have anything to do with these places. If you apply for one of those, you totally scout the system. And since you have a reform compliance, you're not subject to any tax penalty. The only time, whether you're purchasing new coverage from any agent or anybody for next year, if you want tax credits, subsidy to help pay for some or all of your premium, some of the information has to be routed to the government, because that's going to be any portion of your income that you are paying. And as agents, we do have a way to get that information to healthcare.gov without going to that particular website that we continue to hear is so fraught with problems. But if you want any help paying your premiums next year, you do have to share your personal information with the federal government, because that's who would be helping you pay the premiums.
Thank you.
My pleasure.
I understand now.
Okay, great. Well, I'm glad I was able to help somebody. Anybody else have questions? One more chance.
Hey, Fred, there's one in the chat box that I just reposted for you.
Oh, thank you, Amanda. I'm not sure how I missed that. Hey, Craig from Asheville. Asheville is a beautiful city. I look forward to being there in about 3 weeks. Can I set up a savings account using an Obama insurance plan? That's a good question, Craig, and it's one that I've been asked again and again and again the last couple of months. There are HSA compliant policies available in 2014, both on and off the exchange. So just like if you were buying a 2013 plan, if you wanted to open an HSA, you would need to make sure that the policy you were selecting was HSA qualified, allow you to do so. There are HSA qualified options available next year. In most states, there are not many as there are this year, but I haven't yet seen a state that doesn't have at least 2 HSA options. And the state that comes to mind that only has 2 is Texas. Right off the head, I can't see how many are available there in North Carolina, but I do know there are some. So, Craig, while I was kind of addressing your question, if you have any follow-up to that, you can feel free to leave it in the chat or ask verbally. I'm sorry that I missed you before. Right. I will elaborate on an HSA since I didn't really touch on that at all today. And the main reason I didn't mention HSAs is, we were here to talk about how to avoid Obamacare. Well, if there's anybody on the line that's considering maybe getting subsidized coverage next year, well, the amount of subsidy you get is based on how many people are in your household as well as your taxable income. And if you get an HSA qualified policy and you can contribute money to a health savings account, that lowers your taxable income. I've actually talked to quite a few families in the last couple of months that were just above the income level and they thought they couldn't get a subsidy. And I showed them how, if they got an HSA qualified plan and contributed to the account and lowered their income just a little bit, that they actually could get a subsidy after all. And the most dramatic example that comes to mind, I had a couple in their early 60s, and their premium for a new policy next year was going to be something like $14,000 a year. They had estimated they were going to make $65,000, and as a household of 2, if you make $62,040, you get no subsidy. I suggested they consider it HSA. At first, they told me they wouldn't have money to fund the account. And then when I showed them, if they put $3,000 into their HSA, lowered their taxable income from $65,000 to $62,000, they were going to get a subsidy or assistance paying their premium from the federal government that totaled almost $12,000 next year. So instead of looking at paying $14,000 to get a new policy, they were going to pay less than $2,500, all because they were smart enough to talk to an expert agent that knew what a dramatic difference as little as a couple of dollars can make in your income. And you can rest assured that particular couple got the HSA qualified plan we talked about. I have no doubt they're sticking $3,000 in their account next year, because if they don't and they show an income of $5,000, they're going to have to pay back that $12,000 almost subsidy that they got throughout the course of the year. Yeah, anybody that's looking at coverage for next year, if you're maybe we're not going to go for an Obamacare plan because you knew you wouldn't get any help and maybe your income was just a little bit over the threshold, give us a call and talk to us about an HSA qualified plan. We'll find the one that works for you, And especially if you're a couple in their 60s, we can maybe show you how to save $12,000 in premiums next year. Just because you set a couple $1,000s into an HSA account, you could turn around and use here to pay your medical bills with dollars you didn't pay a penny of income taxes on, yet helped you get more premium. And I will say the examples are not always that extreme. I obviously remember that one particular case because it was such a dramatic difference. But I've talked to many, many people that lowering their income a couple $1,000 would save them 4 or 5 times or more than what they were going to put into an HSA. It's like an awfully smart approach. Any other questions tonight? Well, if not, I thank everyone for joining me. I hope you're all coming away with your questions answered. Maybe some of you that came hoping to avoid such an expensive plan next year as some of the quotes you may be seeing, or have walked away with some ideas on how you can at least save you and your family a lot of money next year. And of course, if you need any assistance in seeking any of these coverages or considering any or all possible options that may be available to you, we are certainly here to help. And I'm not sure how my screen went away from our phone number, but if you do need our assistance, please give us a call. Our toll-free number is 866-749-2039. That's 866-749-2039. Or if you prefer just to email a couple of questions and follow up with your advisor that you've already been working with here in the company. Or if you happen to not be somebody that's already worked with one of our agents, you can send an email to this email address here on the screen, which is saleshelp@saveforamerica.com. My assistant will be routing questions to somebody who will be glad to help. So thanks everybody for your time. Wish you all a great night. Good luck getting through Obamacare next year. Get any help, you're here to be of assistance. Take care.
We never do our taxes till October, and when we find out if we have an extra tax liability, it's too late then.